Hi everybody, my name is Aliah. Welcome back to 4AR People. Thank you so much for tuning into this video. This one is going to be explaining a little bit about something that has been coming up a lot more recently, especially what's going on with U.S. Congress. And normally we don't get to talk about the U.S. Congress stuff, but this one's going to be a little interesting, and it's going to be about Medicaid work requirements and what those are and what they mean for Arkansas. And they're actually not a good thing. So we're going to be talking about that. And if that is of interest to you, make sure you stay tuned for the whole video. Let's do it. All right. So first, if you don't know what Medicaid is, so Medicaid provides health care coverage to millions of Americans all across the country, including eligible low-income adults, children, pregnant women, elderly adults, and people with disabilities. And it's administered by states, but according to federal requirements. And then the program is funded jointly by states and the federal government. Medicaid work requirements is something that many conservatives have been obsessed with, decreasing the amount of spending on Medicaid on a state and federal level for years, right? For years. And so a Medicaid work requirement is a provision that requires certain Medicaid enrollees to participate in community engagement activities. That could be work, school, job training, volunteering, whatever, in order to maintain their health coverage. So it's hinging that community engagement on their access to government-funded healthcare, right? And you may be like, Aliah, people should work, blah, 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 blah. It's not that easy, and I'm going to tell you why. So Arkansas is no stranger to Medicaid work requirements. In fact, we have tried it on multiple times. So back in January, you may recall Governor Sarah Huckabee Sanders. She sent a letter to the U.S. Department of Health and Human Services and also Robert F. Kennedy, and requested a waiver to allow Arkansas to implement a work requirement for all able-bodied working age recipients of Arkansas Medicaid expansion program. So that, I believe it was 19 to 64 was like the age range. And that is what she did. She submitted that waiver. I don't think it's been approved yet, but this is not the first time that Arkansas has tried to implement work requirements on Medicaid access. And so back in June of 2018, my bad. Back in June of 2018, Governor Asa Hutchinson actually implemented work requirements, but that was blocked by a federal judge in April of 2019. So from June 2018 to April 2019, there was sort of work requirements for Medicaid in the state of Arkansas. But the federal judge blocked it in April 2019, stating that it was incompatible with Medicaid's goals. But by then, over 18,000 Arkansans had already lost their health care coverage. And you might be like, Aliah, why is this relevant? Besides the fact that Governor Sarah Huckabee Sanders earlier this year requested that waiver, it's also relevant because if you haven't been online or haven't watched the news recently, Donald Trump has been trying to get a bill through Congress called the One Big Beautiful Bill Act, whatever. And it has a lot of things in it. And one of those things is a work requirement for Medicaid and also Medicaid cuts and SNAP cuts. And it has a lot of bad stuff in it. And this is one of the bad things in there. So now I'm going to talk about why work requirements are actually bad, why they're not good for Arkansans or anyone. And I'm going to talk about that. So let's move on. All right, so one of the main reasons, in fact, the most compelling reason, in my opinion, that work requirements are bad is because they don't work. Believe it or not, they don't work. More than 90% of U.S. adults eligible for Medicaid expansion are already working or could be exempt from requirements. And that's what we saw in 2018. When Governor Hutchinson tried to implement this in Arkansas the first time. It did not increase the workforce, and then it just makes it more likely for people to be uninsured because the paperwork is the problem. It's not that people don't work or aren't working. The paperwork is the problem. When they did it in 2018, people had to enter their volunteer and work hours in this like glitchy website that was like developed by the State Department of Human Services. First of all, that's inaccessible. Think about the people. Think about the all the people in rural communities in Arkansas and think about them having to implement their work and volunteer hours or whatever their community engagement may be. Think about them having to implement that into this website that is confusing, that is glitchy, that is completely inaccessible to someone who maybe doesn't have Wi-Fi. We have a major broadband issue in the state of Arkansas, right? And it's like everything is online except voter registration. That's interesting. And that's a little side note. It's like everything's online, but that crazy. And also the state of Arkansas. So Arkansas ranks pretty low in healthcare, just in general. Let me actually pull up the exact number. All right, so Arkansas ranks 47 in healthcare already, right? So our healthcare is already not up to par where it should be to take care of Arkansans. Now, is it? No, it's not. And then on top of that, it's like in the state of Arkansas, there's about 3 million people. 3 million, give or take, right? And over 1.1 million Arkansans are employed. That is not bad. That's actually pretty decent, right? Like, so according to Forbes, Arkansas's unemployment rate is about 3.7%, right? And that's not even in the top 10 worst in the country. That's one thing Arkansas is not the worst of is the unemployment rate. And it's lower than the national unemployment rate, which is 4.7%, right? So this myth that people who are getting Medicaid are not working, or people who are receiving government benefits aren't working and they're lazy and all this stuff, it's like that is not true. Arkansas does not have a workforce problem. In fact, we're up from where we have been in the past. We do not have a workforce problem. The paperwork is the problem. More paperwork means more uninsured Arkansans, right? And I think we can all agree out there. I think we can all agree that people should have access to health care. They should have access to doctors and access to the care that they need to survive. I don't think that's like an idea that's unpopular. But this work requirements and like tracking and reporting people's hours and how much they're working based like to get healthcare coverage just seems kind of wrong and evil, right? It's like people need healthcare. That's like a necessity to live, I feel like. And so it's like it doesn't make sense to require people to track people in that way. We've seen it here in Arkansas. We've tried it. It doesn't work. The only actually major change that happened after a workforce or a work requirement for Medicaid is the number of Arkansans that were insured, which it decreased. And that is a bad thing. That is a bad thing. And I'm not saying people shouldn't work. That's not what I'm saying at all. But there's no proof that people don't. There's no proof that people who are on Medicaid are not working. There's no proof in that. In fact, there's proof in the opposite. It's like there's proof in the opposite because back when they tried it in 2018 under Governor Hutchinson, the policy did not boost employment for adults. And it just because nearly all individuals that were subject to the work requirement were already either employed or qualified for an exemption. So this doesn't do anything but kick people off their health care. And so now I want to talk about what happens when people do not have access to health care in our state. Let's talk about that. All right, so studies have shown that without access to cost-effective health care, many people don't see doctors for preventative care, which is better for them and cheaper for the state, right? Because if people are not getting preventative care, they're sicker. And when things get really bad, they have to go to the emergency room and go into debt for emergency room visits that they cannot afford. It creates a public health problem, right? It's like less people in the state of Arkansas who have access to healthcare means an unhealthier Arkansas, right? And that's not what we want. It means a poorer Arkansas, right? Because people are going into debt for health care to get the care that they need, right? And shout out to Arkansas, right? Arkansas was one of the first states in the South to expand Medicaid eligibility to low-income adults, right? And it's just like we've fallen so far. We've just fallen so far. It's like people should have access to healthcare, and the myth that people aren't working, people on Medicaid aren't working, is just false, because we've seen it when we've tried things like this. It's like the people who are subject to restrictions like this oftentimes are already working or are subject to an exemption, right? And so it's the paperwork that gets people and kicks people off of their healthcare insurance, and like all this red tape and jumping through hoops to get the coverage that you once already had, right? It's like a new rule change, and you already had coverage, and all of a sudden you don't have coverage anymore because you didn't fill out a certain paperwork, is insane. And that's not the reality we should be living in. So yeah, that's all I have to say on that. Yeah, let's move on to the outro, maybe. All right, y'all. Thank you so much for watching today's video. If y'all liked it, if y'all enjoyed, if y'all learned something, make sure to comment below, like, share, comment, subscribe. All those buttons are there somewhere. It looks like we're stuck with the One Big Beautiful Bill Act, right? Because it's passed the House the day I'm recording this, so it looks like we're stuck with it. And so we'll obviously be talking about how that will affect Arkansans down the line. But make sure you subscribe to keep up with those videos and stay in the loop with that. Thank you so much for watching. It's been so real. Make sure you follow us on all our other platforms. We've been really doing stuff with like kind of showing people the realities of the state of Arkansas, especially like in comparison to other states. So make sure you go check that out on our Instagram and our TikTok. We also have Twitter, we have Facebook, we have Blue Sky, we have YouTube. So make sure you check us out on all our platforms to stay in the loop what we're doing, and also the state of Arkansas. Yeah, thank you all so much for watching, and have a great rest of the day. Bye.